everyone. My name is Osman or Oz Ahmed. I'm an interventional radiologist at the University of Chicago. And today I have the pleasure of talking about our article, which is titled Transsplenic Portal Vein Recanalization and Direct Intrahepatic Portosystemic Shunt Placement to Optimize Liver Transplantation. So the background of this paper was that we were presented with a very challenging patient who required a liver transplant. And we came up with a novel solution to help optimize that liver transplant. We felt that this is important for the field of IR because it really outlined a unique solution for a difficult problem and was a very collaborative approach to facilitating this transplant for this patient. I think what's unique about this paper is that we essentially took two different techniques, the first being DIPS, and then the second being a transsplenic portal vein recanalization, and essentially combined those two techniques to provide a unique solution for this patient. And so I think what we can learn from this paper is that we are constantly sort of pushing the limits in terms of how we use our techniques to provide unique solutions for our patients. Yeah, so I think there's a really important message from this paper in that we know that patients with chronic portal venous occlusions represent a big challenge for our transplant surgeons, and there's a lot of literature that shows worse outcomes for patients who have this condition. And this paper again really builds upon existing literature that really states that portal vein recanalization is an important tool and technique for patients undergoing transplant. And so again, this is a paper that I think moves the needle forward even further to show that we're able to help these patients and again represent important collaborating partners with our transplant surgeons.